Have you ever wondered how much radiation you are exposed during a medical scan? Do you know which imaging modality uses the most radiation? If you want answer for these questions, this video is for you. Why it is important to know about radiation dose? In modern healthcare system, there is increasing use of imaging for diagnosis of diseases. Higher or cumulative dose of radiation can lead to many health issues. Long-term effects of sustained exposure to radiation can cause DNA damage which can lead to cancer, cataracts, and infertility in some cases. On the other hand, there may be risks to future generations due to genetic mutations passed to offspring. Long-term effects depends on dose, strength, and sensitivity to radiation of a person, with cancer being the most significant risks. Therefore, understanding radiation dose can help you make informed decisions about your health. Welcome to Info Radiology. Dr. Raj here, I am a radiologist. Today, we will understand radiation dose, what it is, how it is measured, and its significance. Before we jump into radiation dose of specific imaging techniques, we will first explain what is radiation dose and what is background radiation. After this, it will be easier to explain about radiation dose received by humans for different types of imaging techniques like X-rays, CT scan, and mammogram. For CT scan, we will go into little more detail about specific body parts. Radiation dose refers to amount of ionizing radiation a person is exposed during a medical procedure. In medical imaging, various units are used to measure this. The most common ones are absorbed dose, equivalent dose, and effective dose. Absorbed dose is amount of energy deposited in human tissue by ionizing radiation. It is measured in gray, where 1 gray is equal to 1 joule of radiation energy absorbed per kilogram of tissue. Equivalent dose is used to quantify the biological effect of radiation by using a weighting factor. Different types of radiation have different weighting factor. For example, weighting factor for photons which are used in X-ray imaging is 1, which is same as weighting factor for gamma rays used in nuclear imaging. Radiation like beta rays and alpha particles have weighting factor of 1 and 20 respectively. They are not used in medical imaging. Therefore, equivalent dose can simply be calculated by multiplying absorbed dose with radiation weighting factor, and it is measured in CV8. Effective dose accounts for the sensitivity of different organs and tissues to radiation. Different organs like the brain, heart, and lungs have different sensitivity to radiation. With effective dose, this variability is accounted for by using tissue weighting factor. Therefore, effective dose can simply be calculated by multiplying absorbed dose with radiation weighting factor and the tissue weighting factor. Similar to equivalent dose, the unit for effective dose is CV8, and we usually use milli-CV8, with 1 CV8 being a very large dose. I know this might sound a bit confusing at first, but it is easier to understand once you break down its definition. Simply, the main difference is that the equivalent dose accounts for the type of radiation, while effective dose accounts for both the type of radiation and the sensitivity of tissue or organ. Let's move on to background radiation. Background radiation is radiation we are exposed to every day from natural and human-made sources. The major source of background radiation is from radon gas. Other sources are terrestrial radiation, medical radiation, cosmic radiation, and internal radiation. Radiation from consumer products forms a small part of background radiation. For easier understanding, in this video, we will compare the radiation doses across various imaging modalities to background radiation and chest X-ray. Remember that the doses provided are approximate and may slightly vary in different locations depending on various factors. The average annual dose from all background sources is around 3 milli-CV8 per person. Let's move on to doses of various imaging modalities. An X-ray scan typically delivers a low radiation dose, making it an essential tool for many diagnostic needs like chest exams or fractures. Chest X-ray is a low-dose imaging technique with average dose for chest X-ray is around 0.1 millisievert, which is about the same as the natural radiation you are exposed in 10 to 12 days. An abdominal X-ray gives a dose of 0.7 to 1 millisievert. Dose of one abdominal X-ray is similar to 85 to 122 days of background radiation. If you undergo a dental X-ray like OPG, it gives a dose of 0.005 millisievert, equivalent to a few hours of background radiation. Moving on to the dose of CT scan. The radiation dose of CT scan depends on body parts being examined. Therefore, let's discuss them separately. For CT scan of the brain, which is commonly used to assess conditions like stroke, head trauma, or brain tumors, dose of single CT scan of the brain is around 2 to 4 millisievert, which is equivalent to 1.5 years of background radiation or 20 to 40 chest X-rays. Next, let's discuss about abdomen CT, which is commonly used to diagnose conditions like appendicitis, kidney stones, or abdominal trauma. An abdominal CT scan delivers a radiation dose of 5 to 10 millisievert, which is equivalent to approximately 50 to 100 chest X-rays or background radiation of approximately 3 to 6 years. Finally, let's talk about chest CT. This is commonly used to evaluate conditions like lung cancer, pneumonia, or pulmonary embolism. A typical chest CT delivers a radiation dose of 7 millisievert, which is approximately 30 to 70 times the dose of single chest X-ray, and background radiation of 4 years. Finally, let's talk about mammogram. A mammogram is a specialized X-ray used for breast cancer screening and diagnosis. The average dose for a single mammogram is about 0.4 millisievert and roughly the same as natural radiation you are exposed over 50 days. How to reduce radiation exposure? Given these higher radiation doses, while undergoing medical imaging, it is crucial to always apply the ALARA principle, as low as reasonably achievable. This means we should always try to minimize radiation exposure while still obtaining the necessary diagnostic information. Your doctor will recommend imaging only when necessary, carefully weighing the risks against the benefits. Some of the ways to reduce radiation exposures are avoiding unwanted scans, using shielding like LED aprons when possible, adjusting machine settings based on patient size and area being imaged, and limiting the number of scans, especially in children and pregnant women. In summary, out of the different units used to measure radiation dose, effective dose takes into account both radiation type and sensitivity of tissues to radiation, and it is commonly used to compare radiation dose across different imaging types. Chest X-ray delivers a radiation dose of about 0.1 millisievert, which is equivalent to 10 to 12 days of background radiation. Mammogram have slightly higher dose around 0.4 millisievert, comparable to 50 days of background radiation. The dose of CT scan range from 2 to 7 millisievert. Thanks for joining us today. Please like, share and subscribe for more radiology content.